Everyone, my name is Anna, and this is my friend.
Hi, my name is Helen.
Welcome. Recreational therapies or RT innovations plays an important part in the healthcare system because it makes a positive impact on many people's lives in improving quality of life, especially the older adults population worldwide. Today, we will introduce the most advanced, unique, adapted technology to improve the quality of life of older adults in nursing homes. This is called virtual reality therapy or VR. We are delighted to be invited by Shark Tank Live Television today. We are super excited to present to you VR therapy devices innovation. VR is a technology that creates an immersive environment or experience using computer-generated elements. It is designed to make users feel as though they are physically present in a different environment. VR has a head-mounted display, motion tracking, audio, controllers, and computer hardware. And now we would like to invite you to travel with our elderly, to travel the world with the VR.
It's just like you're there. And it don't cost you a lot.
Rendever is a virtual experience that our residents can explore places that they've never thought that they might go to, or they can revisit some of their favorite places.
Oh, look at that pretty blue fish.
The headset allows them a 360-degree experience. So if they look down towards their feet, they would see what is below them. If they looked up to the sky, they would see what's above them.
I'm looking at a goat. Oh, and it's right there. I don't think I've ever seen a chicken that close.
It allows them to, say, go to the Grand Canyon or be in Paris at the top of the Eiffel Tower. The ability to travel to places that may be physically a bit more challenging for them to do in the current state. One of the things that I'm most proud of that Country Meadows does is invest in technology. Usually it's an utter awe, eyes open, and they're exploring their whole environment. So the head is moving all around. You see them turning because everywhere they look, they're going to see something. Residents who prefer not to wear the headsets can also partake in the activity through mirroring to a TV screen with one of our smart TVs. This allows those in the audience to still visit that very special place or take part in that experience without having to wear the headset and have the 360-degree visual impact.
There's shooting stars up there too. It's
A lot of stars.
Anytime you raise that level of excitement, of curiosity, of adventure, you create an environment that is focused more on well-being. So you can have more conversation, more interaction. It's good for our brain health when we're challenged with a different experience.
I've never seen anything like that. That's wonderful.
The residents really enjoy it. Part of what they're enjoying is observing their peers laughing and looking around and, you know, the look of surprise on their faces. So they're enjoying it as a group experience.
I've never seen this before. That's wonderful.
So there are many benefits when older adults have an opportunity to use VR. Firstly, maintaining or improving cognitive stimulation through VR experiences, in recording sweet memories, and it would be valuable for people living with dementia. Secondly, improving social engagement for those with limited mobility to enjoy VR leisure activity with family and also reduce loneliness and isolation. Thirdly, it is perfectly for therapeutic application and it helps in improving relaxation and reducing symptoms of stress, anxiety, or depression, improving physical exercise, education, and lifelong learning to improve quality of life. And lastly, VR has been used successfully, allowing residents to distract their attention from pain and irritation by engaging themselves in a peaceful and enjoyable VR environment, as VR perfectly for pain management. And let's go. And Helen will lead us deeply about how we can apply VR in nursing home.
Yes. So you might ask, how can our residents have the VR experiences? First, we need to purchase the VR devices. We can purchase VR devices from the online or offline electronic retail stores. The second option is we can outsource from VR specialist companies which are able to create customized visual experience for our residents and provide a VR consultation for the device installation, troubleshooting, maintenance, and staff training. The third option is our aged care IT department can work with our recreation therapists for the VR therapy implementation. Then, what we need for the VR therapy? We need a VR headset, internet connection, chair or sofa for the resident to sit, electronic device to install VR applications, TV in the case of the casting, and we might need a controller or smartphone. So we don't need to purchase extra equipment beside the VR device itself. So VR devices is not a genie in the magic lamp. We know that we need to take into consideration for few things for VR therapy. Before initiating the VR therapy, we will identify potential risk and set up the risk management plan. We can start with the pilot trial for 2 months with the 5 devices in one residence care for the 10 residents who are curious about VR experiences and wanting to participate in VR therapy trials. After completion of the sessions, we will collect the feedback and evaluation form from the participants about their VR experiences. Based on the feedback, we will identify some issues and rectify them. Then we can increase the number of the devices to offer more services to our residents and expand VR therapy services to multiple residential care facilities. Additionally, we will have the hygiene issues as VR devices will be shared between different residents. So IT staff will clean up all devices with a dry hygiene paper after each time used to prevent any high potential spreading the virus between the different residents. Then, recreation therapy and other staff are ready to implement VR therapy. Yes, we are. Recreation therapists will communicate with the other allied health professionals to assess the participants to ensure that all of the listed participants are safe to engage in this activity and obtain desired health outcomes to reach their individual goals before starting the program. All staff in the resident care will be informed in regards to the VR program's time, duration, names of the participants, and the location where the activity will be held on the notice board and verbally. There will be one recreation therapy specialist as a main facilitator to lead a program, and RT staff will assess the participant for the safety. Once the program starts, all staff will ensure that all the participants are sit on the chair. However, if the participants stand up during the activity, RT staff will assist the residents to prevent any potential incidents. The participants will stop any time when they feel dizzy or uncomfortable. Once the VR program is completed, RT will evaluate the program based on the feedback and observations to ensure the participants would obtain better VR experience for the next sessions. Next, I'll pass on to Anna.
Wow, thank you so much, Helen. She gave us very clear instruction about how to do VR in nursing home. So let us transform life together by investing in VR for our residents. We must embrace this transformative technology to improve quality of life of our beloved one. Enhance resident well-being, reduce long-term costs, empower our caregivers. Let's engage with us for this mission to provide possible care. Your support will help us to create an environment of engagement, joy, and healing. Share your idea, insight on how VR can benefit our residents. Allocate the necessary to our nursing home. Encourage family member to cooperate with us. We believe that we can create a future for our residents, joyful life enriched by the wonderful of VR. It is an investment in their happiness, health, and hope. Together, we can make it happen. Thank you so much for today.